Thank you. We wanted to come in here and talk a little bit about GASB 67 and 68. Probably seen a few presentations on it in the past. So our goal is to come in and you've heard a lot about deferred inflows and deferred outflows, but maybe you're wondering, how does this actually work in practice? So the main goal today is to go through a very detailed example. There's a lot of numbers involved, so bear with us. We have a lot of time, so if you have any questions, please stop. We have 2 hours, I believe. We have about 45 slides. I don't think it'll take us that long to get through everything. So please, if you have any questions along the way, stop and ask us. As I mentioned, our goals are just to go through a real detailed example and show you how this thing actually works in practice.
I'm kind of glad that I was a little bit late coming in today because of another meeting I had to go to this morning, and I was glad to hear Elisa's talk because it kind of leads into a lot of what I'm going to be talking about today as well. But I did pulmonary rehab for many years with Dr. Richard Zawalik over at St. Francis, and so pulmonary rehab has been a part of my life. I've worked in vent weaning units, so have seen really patients at the extreme ends of their illness, and currently working with patients who have been hospitalized with COPD and following up with them after they leave the hospital. We're at Hartford Hospital, we're actually calling every patient who has had a COPD admission and following up with them within 48 hours, whether they go home with VNA, to a SNF, to an LTAC. So it's amazing some of the information.
And one of the key factors, though, here is this. This is one area. You know, I was in the military for 21 years. And after retiring as a chief petty officer, as an independent duty corpsman, where you're the doctor, the dentist, the nurse care practitioner, the health administrator, and all the other jobs that happen in the medical field itself while you're out there on a small ship, you're it. And one of the key factors is that traveling around and coming to your different dental offices, one of the things that I help do when I come to your office is I look at to see, hey, are you really ready for this medical emergency? Why? Because at any given time, something could happen. Someone could go into cardiac arrest while you're doing a simple thing as, you know, a tooth extraction. Or the other thing that could possibly happen is the diabetic patient first thing in the morning. They come walking into your clinic. And so today we're going to talk about some different things. And the first thing I want to talk about this morning is this: scene safety. You know, we come in on a daily basis and we get used to the same routine. Someone turns the lights on, we go over there, we turn the computers on, we get ready, we're setting up our exam rooms and everything else. But one thing that we lack is scene safety. For example, now, we were going to do a major shoot last week, but we had some run-ins where we couldn't.